Hello, lovelies. Welcome back to my YouTube channel. Thank you all for sharing your honest opinion on the previous episode of Your Opinion Matters. Genotype compatibility is a great factor that needs to be considered before going into any relationship. As we all know, genotype is the genetic makeup of an individual, that is the sum total of all the genetic makeup. There are basically five types of blood genotypes, which are genotype AA, AS, AC, SS, and SC. So let's move on, guys. Let's move on to the genotype compatibility. Let's take, for example, individuals that they are both AA, that their genotype is both AA. They are very much compatible. They can marry and have a child with each other because they do not have a slightest trait of sickle cell in their gene. They are 100% compatible. Whereas AS and AS individual, they are not compatible. They are very much incompatible because they are both carriers for the sickle cell traits, and them coming together and having a child together gives them a possibility of birthing a sickle cell patient. Therefore, it is not advisable for an AS and AS individual to marry and have a child together. SS and SS individual, they are not even compatible. Don't think of it. You cannot marry an SS if you are an SS because you both are both patients of sickle cell anemia, and you coming together, there is 100% guarantee that you will birth a sickle cell patient. SC and SC individual too are incompatible. Okay, let's move on again. AA and AS, they are compatible, though they have the likelihood of giving birth to a carrier of sickle cell traits. AAAS, they are compatible. AASCS, they are compatible. AASC, they are also compatible. ASSS, they are incompatible because they both have the gene for sickle cell anemia, a carrier and a patient. They cannot marry. They have 95% chance of giving birth to an SS individual. ASSC too, they are not compatible. They have the chance of birthing a sickle cell patient. They have higher chance of birthing SS patient. So from the previous slides, it is clearly stated that it is only an AA individual that can marry any other genotype without birthing a sickle cell patient because they are neither a carrier nor a patient. They have no gene or no trace of sickle cell anemia. If two people of incompatible genotype should marry each other, there is a higher chance of giving birth to a sickle cell patient. A sickle cell patient is prone to having attack from time to time, and most of these crises deals with the musculoskeletal system. Most of them complain of joint pain, muscle pain, inability to walk, and also they are highly susceptible to infection because they have weak immune system. And most of those patients with sickle cell anemia do have low PCV, and they are mostly being transfused with blood, and they have a slimmer chance of living longer due to infections and most of these crises. It is most advisable not to let love or any other factors or pressure make you make decisions that you will regret throughout your lifetime. Do not make your children go through unnecessary trauma and stress. Know your genotype now and break that relationship in which you are not compatible genotypically. Now to the issue of my aunt that is almost 40 and approaching menopause, and she is still very much single. My advice to her was that she shouldn't go ahead with the relationship as the risk is greater than the benefit. If it was companionship that she wants, she can go ahead and marry the man, but she should not try to have a child with the man. Thanks for watching, and also happy Valentine in advance. Remember, know your genotype. Bye.